welcome to DRX podcast new episode. In this podcast, we invite people from the field of pharmacy, and today we have a very special guest with us. She is PharmD. She is BCPS, board certified pharmacotherapy specialist.
So without getting any delay, so let's welcome Dr. Anita Ann Sunny, PharmD, BCPS. And today in this podcast, you will get all your answers.
So let's start this.
Hello, ma'am. How are you?
Hi, I'm fine. I hope you are fine too.
Yes, ma'am. So before starting, I want your brief introduction. So please introduce yourself.
Yeah, myself, I'm Dr. Anita Ann Sunny. So I did my PharmD from PhD College of Pharmacy, graduated in 2016. And from 2017 till date, I've been working in the Department of Neurology. So for the past 6 years, I have been working as a clinical pharmacist, and recently I was upgraded to pharmacotherapy specialist. But I'm continuing my journey in neurology itself.
Ma'am, my first question is how's your PharmD journey and what are the challenges you face in your journey?
Yeah, PharmD, it was nothing planned. Uh, when I completed my 12th, it was like all of them were choosing MBBS, nursing, and engineering, which was the trending courses. So the only thing I told my parents was like, give me something, some variety course that I could do. And my parents came up with this PharmD. So it was totally new. And in 2008 only, it was introduced in India. So with just two patches and so many dreams and what to tell, all the colleges were telling about the scope abroad, and no one spoke about anything in India. And we also never thought about what will happen in our country. But okay, at least there is some scope in abroad, and that's how I also came to PharmD. I didn't come expecting some job opportunity abroad, but just wanted to explore what is this PharmD, some new course, a 6 year program, integrated PG. Okay, just completing one course will give you a PG degree also. And of course, a DR in front of your name. But without knowing anything about PharmD, what is the course subject or what we are expected to do, I just got into the journey and I just went with the flow. And first year was really tough, and I'm sure it was tough for all of you.
Yes,
With the physiology, I think that subject came first in university exams, so there was some extra efforts to learn that subject. And going through biochem, the inorganic, organic chemistry, everything was like Greek and Latin totally. So I'm thankful to our university, the Tamil Nadu Dr. MGR University. They had grace marks for us when I wrote my exam, and because of that, I passed without any arrears. So I'm really thankful to the university. Just after our batch completed the first year, they took away this grace mark system. But very lucky enough to get those, so I could complete the whole 5 years without any arrears. So passing the first year was the toughest thing actually. Once I got into the second year, it became interesting. Getting knowing the
Pharmacology.
clinical side. Yeah, more than pharmacology, actually, pharmacology was tough, but pharmacotherapy gave me some hope. It was like light at the end of the tunnel, I could say. So, even though I didn't understand pharmacology, pharmacotherapy made some sense. And then I was like, okay, pharmacology is used, it is applied in therapy. And then I started understanding and learning pharmacology. So, pharmacotherapy was and it is my favorite subject in PharmD. I guess it is the same for most of them. And other this pathophysiology, everything started making some link, and there was some connection between all those subjects. So the interest was better compared to the first year. And also we had some pharmacy postings during our second year. So I got an opportunity to work as part-time pharmacist in our hospital pharmacy. So it made it easy for me, familiarizing with the medication names, knowing the brand names, doses. Uh, just dispensing the medicine alone helped me a lot to learn the medicine names and doses. So whenever I wrote this pharmacology and pharmacotherapy exam, dose and name was not at all an issue for me. Nothing like by heading or memorizing.
It's like a cup of
Yeah,
tea for you.
it was really fun. So I enjoyed my part time also, and all the hospital pharmacists helped me a lot because I was just a second year graduate I mean, second year student, and they knew how much I struggled, and they supported me a lot, especially in learning the Tamil language. There were few people who really came to help me, counseling the patient and telling me what each and every drug was used for. Even though we were supposed to learn that in our PharmD course, the pharmacist helped me a lot in my second year. So second year was really an eye opener for me, and slowly I started getting more interest in this course. Then the third, fourth, fifth year and all went, and then the internship came, and yeah, it was good going for rounds. In our hospital, they gave the opportunity for 12 months physician rounds, and we had exposure to multiple departments.
Yes.
And we also had an, a, an observership program in which two students from one batch will be sent to the Toledo University in Ohio, and I got the opportunity along with one of my batchmates. And 2 months in Toledo gave me a good insight to what clinical pharmacy is and how the clinical pharmacists are practicing. And especially in India, only like few batches were out, and all of them is struggling to create some vacancies, and make the hospital people understand what we could do and what is the necessity for a clinical pharmacist inside a hospital. At that time, when I was in US, I saw how they were practicing, how much knowledge they had, how confident they were in dealing with their cases, and different areas where they were exploring. Some of them were practicing inside the hospital as a clinical pharmacist, and they were discussing and dealing with the patients as well as the healthcare professionals. And they, some of them were practicing in family pharmacies, or what we call as retail pharmacy in India. But they were playing such an important role by counseling the patient, taking care of their medications. They had they were given the power to prescribe or write down the investigations. So even without seeing a physician, they could manage some cases temporarily. And if there was some serious medical issue which required some medical attention, they could refer them back to the hospital for seeing a physician.
Hmm.
That kind of practice which we were not seeing in our country.
Yes.
So I started noticing some good opportunities. Okay, there are so many things to be done in our country, so many vacancies, and so many job opportunities. And more than that, a very fascinating thing was pharmacists taking care of clinics led by pharmacists. For example, diabetes clinic, anticoagulation clinic, where they keep on following the patient, asking them how much their blood sugar and INR values were, just giving them reminders regarding the follow up, visiting the hospital, visiting a pharmacist, making sure that they are adhering not only to the medication but the diet control, other lifestyle modifications they required. Everything was managed by a pharmacist, whether they were called a clinical pharmacist or not. They were taking care of the patient from top to bottom. And I think more than visiting the physicians, they were seeing the pharmacists more frequently. So that's a good change in the healthcare practice. I'm not telling that we can survive without the physician. Of course, they are the backbone, but we also played a very good role in the patient care. So that 2 months during my internship was uh, very interesting, and it helped me learn a lot, uh, what to do next, and what all things we could introduce in our country. All those aspects were explored a lot by me during that time. So that was my PharmD journey. I think I told more about the 2 months time. Of course, the practical applications were a lot more than what we learned. Or else I can put it this way: whatever we learned in textbook, I saw more of practical application during that 2 months time.
Absolutely, ma'am. The 2 month was a game changer for you.
So Ohio,
Yeah, yeah, of course.
ma'am, Ohio is in China.
No, Ohio, it's a state in USA.
Yes.
Okay.
So Toledo was a small place. It's next to Chicago, actually.
So you and
So
your classmate, you both went to USA in your second year.
yes, yes, yes.
That's a
In
great
US,
opportunity.
yeah, yeah. My college gave me that opportunity, and only thing we had to take care was the flight tickets, actually. The other part, visa processing, yeah, like it's a big thing. Just a flight ticket was the main thing and daily expenses. Other than that, the visa processing was easy for us because the US government had given an invitation, a welcoming invitation to us. So the visa, it was just a formality. With that paper, it's like it's a confirmed thing. And we also received scholarship from the Toledo University, so that took care of our accommodation and not only the learning, but we had a good number of days exploring the American culture, and they were also very friendly and accommodating. Very good time.
Yes, ma'am.
It was really nice. I wish all of us got some
Yeah,
opportunity to explore these areas and
Yeah.
exactly.
use such an established clinical pharmacy activities. Of course, we need to know what is happening there. So, what we are lacking and what we could do in our country, it's very much required. So, someone just talking and talking, listening to someone talking about the practices in USA, and we going and seeing what is happening there exactly, that really makes a difference. So I'm just trying to incorporate all those things what I saw into my practice, and I'm sure if I had not gone there, I would not be able to do this much for my patients. That I can tell for sure.
Yeah, it's a good exposure for you to think about what you have to do in your life. And you also told that you in second year you have an interest in pharmacotherapy. That's why you are BCPS.
Yeah,
I,
that's the
I
main
I'm
point.
I'm targeting only BCPS because I have a aim to do BCPS. That's why I only think about BCPS. And you are a neurologist, है ना?
Yeah, I'm
You are
working
BCPS in
in
neuro.
neurology. Yeah.
Hmm. It's a great field, and Pragya also doing.
Last 2 month internship was in NSICU, but I got
Okay.
confused like what to do. I don't know what to do in internship. So my next question is that what are the things a pharmacist or a intern pharmacist can do in hospital?
Yeah, internship is a time where you can explore your clinical activities. So whatever you learn in clinical pharmacy, all the clinical pharmacy services, it starts from looking into the medication chart theoretically. But I would rather tell like it starts from you interacting with the patient. So one thing I felt is a big communication gap. You must have read like we are the bridge between the physician as well as the patient. So
Yes, ma'am.
it's like the physician, because of their busy timing, may not be able to convey all the points regarding their disease and treatment to the patient. So they just coming and visiting and telling, okay, treatment is going on well, and you are responding very nicely, fine. So that is expected from the physician, and it's really very tough for them to detail each and everything to the patient. That's where we can take up the duty, and we can spend more time with the patient. Just interacting with them will help you learn a lot actually. So the disease, the pathophysiology which you learn, you can just try explaining it to the patient, depending on how much they can understand. I'm not asking you to tell about the T cells coming and attacking this one, the antigen coming and attacking this one. No need to go into the depth, but just tell them what is diabetes. It is something where your body is not able to control the blood sugar. So initial, when you were young, your insulin was good, and now the reserve is comparatively less. So you are trying to give some medications to make the tissues realize or make the tissues utilize the insulin, utilize the blood sugar, make the insulin work more. And if it is failing, that's where you have to give exogenous insulin. So some things which you learn, putting it into the layman words and making the patient understand, it creates a big difference in the patient medication compliance also. So patient not knowing what is happening to them, what treatment you are giving, what outcome you are expecting. So all these things, all these questions, if that can be answered, especially by us, because we are well trained enough to counsel these patients, starting from patho. I used to do that, starting from the pathophysiology, what treatment we are giving, what is the expected outcome, is there a possibility for a treatment failure? In that case, do you have an alternate option? So just speak it out so that the patient will be confident in the way, like, even if this treatment fails, we have another option. So they won't be like jumping from one doctor to another. They won't. We can avoid doctor shopping,
Hmm.
which is a very bad thing for the patient because they are not getting a proper follow. The doctor might be having an idea, okay, plan A, plan B, plan C. But if the patient is not aware of it, they might feel like, okay, this doctor is not treating me adequately. And
Hmm.
of course, the patient will also have the same mentality only. It's
Yes.
very easy to blame the patients, but just see ourselves as that patient. If we were in their position, what we would have expected from the doctor. If the doctor is not able to provide it, at least if someone else, if the nurse had given me this information, if the clinical pharmacist can give me this information, will I be able to do better? Will I have some patience to wait till the medication works for me? So these small activities from a clinical pharmacist will make a big change in the treatment. It makes it easy for the physician. It will be easy for the patient to understand. So just I really want to focus on the communication part, which is not specifically mentioned anywhere, but it is like it's something understood in all the clinical pharmacy activities. So even if you're trying to report an adverse event, you need to know when that medication was initiated, how long it took for the adverse event to happen, and was it some small symptom or is it something very disabling for the patient. All this thing without talking to a patient, you are not going to. It won't be easy for it to analyze. So let it be a drug interaction, an adverse event, whatever it is, you need to talk to the patient. So I would like you people to communicate with the patient, not just looking into the medication chart alone, but start talking to the patient. Just get to know what symptoms they came in with. Maybe something the doctor missed and something you picked up, and you may be able to convey to the doctor. It could change the diagnosis also.
Yes.
So don't underestimate yourself. Just keep on talking to the patient. That will be something I would like to stress on more specifically. Along with that, continue your clinical pharmacy activities. Whenever you see a case, whenever you take a case, start from the small diseases like diabetes, hypertension, some commonly seen diseases. Make sure you go through all the medications of the patient as well as the pharmacological classification. Utilize your internship time to brush up all the pharmacology you learned. I always prefer going with the classification. Just know what is the mechanism of action. Don't go into the depth of what this receptor is going and doing, that signaling pathway and activating this and this. Nothing required. At least metformin, it's a biguanide. What it is doing, it is a insulin sensitizer. And what all are the insulin secretagogues? Some simple mechanism, basic classification, what all drugs are coming under each classification, what are the major side effects, what are the monitoring parameters, and for all classification, make sure you know which all are safe in liver, renal, and pregnancy, or the other way, which is contraindicated in liver, renal, and pregnancy, whichever is easy for you. If you can go through this, the classification, mechanism, adverse event, hepatic renal pregnancy. At least if you know this, you will feel more confident when you get out of your internship.
Yes,
I
ma'am.
don't think it's anytime late for you. Better late than never. So at least even if there is 1 week time, you have studied all those details. So just going through your notes or just going through the symbol classification in each class, diabetes, hypertension, take the most common diseases and go through it. Whenever you go through each case, make sure you learn that disease once again. Go through some standard guidelines, and for understanding the guidelines, you need to know the pharmacological classification
Yeah.
because they'll just mention SGLT2 inhibitor, but
Hmm.
unless you know the properties of each and every medicine, you won't be able to tailor the treatment for that particular patient. So just communication, pharmacological classification, going through simple diseases, refreshing whatever you learned. That is more than sufficient to do in your internship. That should be fine. Make sure you're making it more clinical. That is interacting with the patient.